Representative Redman, you're back.
Thanks, man. Appreciate you having me back.
Yeah, absolutely. So a lot has happened since we spoke. It was like 3-4 weeks ago.
Yeah, probably about that.
Something like that. So
Yeah.
we have Medicaid expansion reform. We have sugar and like soda, essentially, and not sugar, but soda and candy in the SNAP program, and then welfare benefits for illegal immigrants.
That's correct.
Okay, let's start with the reform. Now, a question for you, because I've talked to a lot of people about the reform with the waivers in specific. And what everyone has told me, they're like, listen, what the welfare, or excuse me, the Medicaid reform bill is not a reform bill. I'm like, how do you mean? And they're like, because the things that we would need to reform are all but impossible to do. Right now, again, whether people want to repeal it, not repeal it, whatever. Do you think, in your opinion, do you think there's actually a possibility of checking the boxes with the reform requirements? For instance, like going to federal judges in other states and actually having them overturn or reverse their decisions on like transgender medication covered under Medicaid, because that's one of the waivers or one of the reform requirements, right?
No, that's incorrect. Actually,
okay,
it's saying,
help me understand.
Yeah, it's saying that we cannot allow for those transgender surgeries for kids or adults on our Medicaid program. If something like that happened, then it would repeal expansion.
And that's just within the state of Idaho?
Correct. Yes.
Okay.
Yeah. So it's not saying like federally, right? This is a state of Idaho bill, a state reform bill. I think all of those waivers are very attainable. And I think that's why we saw success in that committee and then off the House floor. So now it's in the Senate Health and Welfare Committee waiting for a hearing. But folks that have said that a lot, but all those reforms are well within our reach. And I think they're very plausible to get. Here's the other thing. None of that takes effect. We're going to come back next January and we can evaluate how many of those reforms have made it through, right? If we need to extend that time period, that's well within our authority to do. So it's not a trigger to just repeal Medicaid expansion at all. It's a setting forth safeguards to reform the program and make sure that the program runs efficiently instead of having almost over $1 billion that we currently see again against what was projected with Medicaid expansion.
Okay. Now, to be really clear, because again, it appears that I have been misinformed. Again, I do not present myself as an expert in this at all, but you're saying that we do not, with the transgender Medicaid treatment under Medicaid, you're saying that there is a way that we can just stop that, legally stop that won't be challenged in courts in the state of Idaho. We do not so a federal ruling in Arkansas does not apply to us here?
Well, what we're saying is we don't want to use dollars for the Medicaid expansion population for any of that transgender, reassignment stuff for adults or kids. So that's what we're saying.
Of course.
You cannot do that is what we're saying. We're putting our foot in the ground and saying, do not allow that.
But is that legal in the courts? Like, would that get challenged and overturned? Like if somebody rules in Arkansas, hey, if you're, let's say an adult, forget the kids.
Sure.
If you're an adult, you can use somebody rules in Arkansas that you can use Medicaid dollars for, let's say transgender medication.
Sure.
They rule that in a federal court that applies across the United States. And here in Idaho, we're like, no, you can't. And then the person says, well, they said I could. And you say, but you can't.
We're saying you can't. And here it's in statute saying that you cannot use those funds for that. And so that's the whole purpose of this law. You cannot use that.
Okay, so then we would essentially seek a waiver with the with the federal administration saying, okay, we would like to have a waiver to go against the federal rulings that exist right now to essentially carve out Idaho as an exemption to what those rulings determined.
100%. So this program, this program is a federal state partnership, right?
Gotcha.
And we're setting the rules in this instead of allowing the federal government just to dictate down what we want. So we're saying, no, we want to keep this program, but we want to set the parameters on how this program will be utilized.
Got it. With the work requirement, one thing that people said is like, look, we applied in 2019 and that they could approve a work requirement today, right now. And they could have approved it this entire time, not just during the Biden administration, but President Trump had an opportunity in his first term. And he had, from 2019 until he left in the end of 2020. And he has an opportunity now. If they wanted to approve that work requirement, they would have approved the work requirement.
So I think that's part of the beauty of this bill as well, is that we're setting a time frame on them. Like, hey, you need to approve this by such date. And I think also the thought behind behind that is this administration is vastly different than the first term when he was there, right? I mean, you're looking at the different people in there. You're seeing the speed at which they're working right now. They've asked states, said, we want to see unique, creative ways for Medicaid programs in your state. And they've asked for these kind of waivers. Truthfully, people at the administration have actually asked for several of these, saying we want to get these waivers to approve this.
Got it. So you have different people at the helm this time.
100%.
So even though President Trump is still the same person, the people behind him and gearing these programs are different.
Exactly right. Yep.
Understood.
Yeah.
With the work requirement, and again, I understand 100% saying like, hey, let's not I understand I have to work to get something. That's just the American way. I've heard people articulate a concern that they're like, listen, Medicaid, before we had Medicaid expansion, we had a catastrophic care fund where like somebody employed or unemployed gets in a car accident, catastrophic accident, we're going to offer them care. Like, it doesn't matter if it's, like $1 million worth of surgery, like you're dying and we are going to save you. We're going to fuse your spine or do whatever. That's care that Idaho is going to pay for because that's what we had. But we had a catastrophic care fund that Idahoans had to fill. We had to fill that bucket to dole it out to these things. And Medicaid expansion covered that. And now again, 90 cents on the dollar comes from the federal government. So people have said, look, if we eliminate the Medicare expansion, right, or if we do this reform and we're unsuccessful in succeeding and Medicaid expansion gets repealed, then we're still going to have to pay for these services. We're just not paying through them through the mechanism of Medicaid where we get, 90 cents on the dollar. We're just going to be paying directly and indigent care, which I always screw up that word.
I know, so do I.
Indigent. Forget it. The people, you get what I'm saying.
Yeah.
We had that as like taxing districts and property taxes where we acknowledge that there's a certain portion of the population that is mentally incapable of taking care of themselves. And on our property tax bills, we would have to fund these buckets of care for services for these people. So those things are just going to come back to Idahoans. So some people are saying, hey, look, if this gets repealed, if we don't hit all these waivers and the reform is unsuccessful and this gets repealed, we're going to end up shifting the burden. The burden of the $100 million, it doesn't go away. In fact, like it stays and we just pay for it in a different way.
So one of the biggest keys to that is, you mentioned folks that are unable to deal with themselves. Again, this is able-bodied adults, right? We're not talking about the folks that are disabled. We're not talking about the pregnant women. We're not talking about children. We're talking about one specific group of people, which is that expansion population, which is able-bodied adults, right? And even with the work requirement, we've left it wide open to say you can work, you can volunteer, or you can do some sort of study. And we've left that to interpretation at the department so they can kind of make those determinations themselves. So, those arguments to me are null and void because we have several programs in Medicaid that cover all those folks that are unable to work. If you're not able-bodied, you don't have to.
So, and again, this is the thing that people keep coming back to this. Say, look, we as Idaho will fund catastrophic care whether or not that person is employed. And if we make the work requirement go through, we will now have people who are covered by Medicaid, right, who are volunteering and doing whatever.
Sure.
But we'll have to fund a bucket for people that are unemployed and will get in catastrophic accidents. So we'll actually have to make a new bucket of funding because Medicaid will no longer take care of the people that will inevitably get in a car accident or something terrible. They're like, we're going to actually end up spending more money because now we've restricted where Medicaid covers, where we get 90 cents on the dollar, and we've entered a whole new bucket of people that are not covered here. And the state of Idaho still pays for these people when they get in a car accident, get in an ambulance, and go to the hospital.
So I think that's a kind of a false narrative in itself, in that, we already have folks that maybe aren't on Medicaid, don't have health insurance. And so we're currently paying for some of those folks as well. We're also with this particular bill, I think that we're really looking at, having some skin in the game and trying to help people develop out of, this current, like, I'm just going to stay on Medicaid forever. I'm not going to help myself. I'm not going to really grow in my community. And that's totally should not be the point of Medicaid. Medicaid is a safety net program for folks in a need in a certain time, right? And we should have that program. We want to keep that program. But to say that now we're we're $850 million over where Medicaid expansion was projected. At some point, because it's an entitlement program, we have to pull away from something in our balancing of our budget, right? So if we continue to grow at this pace, at some point we got to pull away from education, we got to pull away from public safety, or we just have to say we're going to raise taxes, right? Yes. So if we don't make reforms now, if we just want to kick and a lot of the folks, it sounds like you've talked to, it doesn't sound like you talked to the right people.
Well, that's why I have you in here. Like,
yeah, exactly.
I gotta hit both sides, right?
If you just want to keep kicking the can down the road, at some point we're in total catastrophe, right? And that's why, the chairwoman of JFAC mentioned that as well. If we don't do something today, if we just want to keep pushing it off, at some point we're going to have to make some very severe decisions, and they're not going to be better than today's decisions.
Got it. And I did have Speaker Moylan, so I did chat with him. But yeah, like I've had like, let's say 3 people in there like, hey, we're really worried about the Medicaid expansion. But again, that's why you come in too. Yeah. Like, I'm an idiot. I just talk to people and have questions and try to understand. So bottom line is, you're saying, look, we have a certain portion of the population that is already not employed and already not on Medicaid, and they may have catastrophic issues. So we're already funding some catastrophic care bucket. That bucket may get a little bit increased as we have a work requirement. And okay, we may not like that, but we're also incentivizing people to grow within their communities and say like, hey, if you want to keep your Medicaid, like start contributing either through volunteerism or work or education or something like that. So you view this as hey, incentivization to some degree, not 100%, but an incentivization. It's like, let's continue making better Idahoans. And to do that, we need to incentivize people to better themselves, either through, again, volunteerism, school, or employment.
It's a hand up, you know what I mean? Not necessarily a handout, right? We want to help people get on that path so that they can have the best success and the best life that they could possibly live. And sometimes putting reforms in place like that will incentivize and help people do that. The other point with that too is, one of the waivers we're seeking is folks from 138 down to 100 of the federal poverty level can go onto an exchange plan, right? So then they're going to have a better coverage, right? They're going to have a private plan. They're going to have an advanced payment tax credit that's going to be significant. So, they're probably paying $3 a month for a better plan, better access, and better benefits. So, it does a lot of different things to help people get into a better place for their health care, help people get into a better place in their communities, and help, just folks grow as just human beings.
I did have Representative Furman on, who is an insurance broker, I believe, and he was skeptical about people's ability to actually get an exchange in that manner, where it's like, by reducing it down to the 100%, and having that gap where it's like, let us do this. He was saying that he didn't think that was a viable option. Do you have like a lot of confidence that would be able to be a viable option?
Yeah, I mean, I think some of his concerns was dealing with the 1332 waiver, which we currently have one. He didn't know that you could have multiple. You can have multiple. However, you can also just amend the current waiver and ask for that on there.
That was what he was saying. He was like, if we add this additional thing onto one waiver, and then one of those things gets rejected, we lose the entire 1332.
Yeah, that's incorrect. You can just amend your waiver.
Got it.
Or you can add an additional waiver. Right? So every state that has an 1115 demonstration waiver also has a 1332 waiver. So again, a lot of those arguments were incorrect, right? And I think that's why we saw the success we did on the House floor, and that's why it's over in the Senate. I will say there probably is going to be some amendments in the Senate. So I just left meeting with some of the Senate leadership and going over some of those thoughts. So.
Gotcha. Well, listen. Thank you for explaining this stuff.
Yeah.
Because again, this is why I always reserve judgment on things. It's like, oh, I don't know anything. Every time I think I have a position, I talk to somebody else. I'm like, oh, you're an idiot. Nope, don't get ahead of yourself here. Okay, awesome. So moving on to candy and sodas in the SNAP program. Talk to me about this.
Yes, sir. Yep. So that's a bill I introduced earlier this year. We had a hearing on it, and it was held until this coming up Tuesday. And essentially what this bill would do is it would be asking the federal government if we can remove soda and candy from our SNAP program. So, the SNAP program is built on having, good health and nutrition for folks that, need some extra help.
Or at least a base level of health and nutrition.
Correct.
Right? Like you're not getting the organic.
No, not at all.
But you're getting like staples.
Exactly right. Staples. Soda is the number one commodity on the SNAP program currently. I don't think many people believe soda is a good nutritional value in your diet, right? So it's fundamentally pretty simple. I think on Tuesday, I think we're going to be able to get it out of committee, but it was held for a date certain. So we're going to take that up again. This is actually follows really in a lot of alignment with what RFK wants to do with the whole Make America Healthy Again program. And I actually was talking about this bill with my mom, and she reminded me that when I was young, we were actually on food stamps. And at that point, it was much more rigid in that it only allowed for like kind of your staples, like some meat, some, rice, beans, some kind of basic nutritional value.
Some kind of dairy.
100%. And she would work, a side job doing some cleaning to make a little extra money and give my sister and I 50 cents to get a treat at the store, right? So folks acting like this is this horrible thing. No, it's trying to, again, give some guidance to like better eating habits to actually help the system itself, right? Because oftentimes if you have poor eating habits, you're going to have poor health, and that just is a burden on everyone. Yeah, that bill is coming back, and I think we're going to be able to get it over the finish line.
Have you gotten pushback from like Coca-Cola?
Oh yeah. Yeah. Pepsi, Coke, a lot of the grocers, the convenience stores, because it's a large part of their
convenience stores.
Yeah, the convenience stores. And again, the good chairman, John Vanderwater, mentioned he used to own convenience stores, and he actually didn't accept SNAP at that point because he said, I mark all my stuff up a bunch, and I don't want to be using taxpayer dollars to come in here when you can go to a supermarket and get everything at half the cost, right? And so that was just a choice he made. But I think that is an issue too, right? If we're not utilizing those dollars correctly, it just it goes back to the whole thing. If I give you $1, you earn $1. There's different value base in it, right? And so I think that sometimes those dollars aren't valued as much, and we're trying to direct it more to let's have good health and nutrition. You look at our WIC program. Our WIC program doesn't allow for soda and candy.
What's WIC?
So that's the for like pregnant moms and young children, the WIC program for like essentially like food stamps.
Gotcha.
And so on our WIC program, we don't allow for soda and candy, right? And they've seen much better results in nutrition on the WIC program than on the SNAP program. So it came up in committee, why don't you just model it after WIC as far as your definitions? And unfortunately, the WIC program is very restrictive. And so I don't necessarily want to restrict everything. I just want to cut out like the soda and candy.
Dude, how many billions of dollars are spent on soda and candy in the SNAP program? Do you know? This has to be billions. I hadn't even look, I'm an idiot, so I hadn't put together this is the same argument with like the drug companies trying to get Ozempic on welfare. Like this has got to be an astronomical amount of money spent to Coke and Pepsi on an annual basis for a program designed to give the base level of nutritional access for poor Americans.
Yeah, I have a flyer on it. Let me pull it up here real quick.
Dude, Siri should know this. Siri should know this. Hang on a sec. How much money is spent annually through SNAP programs for Coca-Cola? Don't let me down. 10% of food 10% of food dollars on sugary drinks. Okay, so how many billions of dollars are spent on the SNAP program? Oh my gosh, this is an article from NBR. The food stamps for soda, time to end $1 billion subsidy for sugary drinks? ? Holy guacamole, man. I could not imagine.
I should have come better prepared.
Listen to me. Listen to me. Don't worry about it. The point is, the SNAP program puts out a lot of money, right?
Yeah, a lot.
And 10% of that, 10% goes to, like I have 3 monster boys. So we spend at least $600 every 2 weeks on groceries, if not more. It's never really more. We have 3 refrigerators. Like they're monsters. My 8-year-old's 130 pounds. Like he's a tank, right?
Yeah.
He's supposed to be like 6'5", 220. Like he's going to be a monster.
A dude.
But if I was spending $60 every 2 weeks on sugary drinks and candy, like that would be crazy.
Yeah. Yeah.
That's a dump truck of soda.
Yeah, absolutely. Yeah. And again, the goal of it is, again, this is a federal government program. We want to make sure that folks have better outcomes on health, on nutrition. And so in my opinion, it was a light lift. I was like, we're just carving out a couple things. I actually thought I was going to have bipartisan support, but it was lobbied very heavily. I mean, there was the grocery stores, there was the, convenience stores. There was just a lot of folks in there.
So those industries are essentially looking at this pipeline of money coming out of the federal government with good intention, which is like, look, let's supply our most vulnerable, or not our most vulnerable, but our poorest of Americans with some level. We don't want starvation in the United States. Let's provide this. And so what the soda industry says, and the soda lobby is like, all right, look, that's a giant pipeline of greenbacks. Let's just get a little straw, pop it in there, and sunk out 10% of it for us. And these people are not interested in health. They are not interested in bettering children's lifestyle. They're not interested in anything other than selling more Coca-Cola and Pepsi to our population using taxpayer dollars. That's their sole purpose.
That's exactly right. And again, it's the number one commodity on there is soda on the SNAP program. The number one. Yeah.
Man, if you don't like pharmaceuticals going after federal dollars, this can't be a good thing.
100%. Yeah, no doubt.
Wow. And if I may ask, from the pushback from legislators, like, am I missing? Because like I don't know all the perspectives. Like, were there perspectives you're like, okay, that's reasonable. Like maybe I don't agree, but like that's a reasonable perspective.
Yeah, I think the biggest pushback was, again, the grocers are saying this is going to be really hard, and we don't know how to put it all on our platform. I think there's plenty of technology on the point of sale systems that they can load stuff in already.
Wait, can they sell beer on the SNAP program?
No, they can't sell beer. They can't sell
the line item right next to this is not that hard.
It's not that difficult.
We have AI.
Right.
I had Rep. Ehlers in here yesterday talking about the AI committee. Yeah. That they're like, we're doing all this stuff. It's like, you just put the SKU number on, man.
Exactly right. Yeah. So I don't think that was a good argument. And then, there were some folks being like, why are we, separating folks? Why aren't we giving them choice on this? And again, I go back to, these are federal dollars that need to be spent wisely. These need to be stewarded correctly. And I don't think that that's the best place for them. So.
Is there anywhere else where we provide free nutrition for people that we include soda? Like,
yeah, not that I know of, right? Again, it's not on the WIC program. So, I mean, I don't think it's the best choice for us to be using our federal dollars for.
Understood.
Yeah.
Understood.
And I think there's long-term effects, right? I mean, you're going to have worse health outcomes at that point, right? We have a childhood diabetes issue, right?
Everybody knows. Make America Healthy Again is probably not a huge fan of 10% of every SNAP dollar going to.
He's been outspoken about it, right? So, I mean, I totally think it aligns with what we're going to see probably federally, but if we don't, and any other concerns like, well, how do we file this waiver? It's simply an email. It's not even a waiver. It's literally an email from our Department of Health and Welfare to the FDA saying, hey, we would like to, or I think it's agriculture, U.S. agriculture, but just to say, hey, we want to pull off soda and candy. So it's not like it's zero cost, right? So it's just asking for it.
Makes a lot of sense.
Yeah.
Welfare benefits for illegal immigrants.
Yes, sir.
Talk to me about this one.
Yep. So another bill that I think we'll probably hear next week, but basically dealing with our welfare benefits here in the state of Idaho, and essentially just saying, hey, we want to use these benefits. So we have a clause in there for emergency benefits. So we don't want people just dying, right? So we have coverage for emergency benefits. However, for food assistance, for housing assistance, for cash assistance, we want to make sure that those are preserved for Idaho citizens and U.S. citizens, right? We don't want to necessarily open it up to just let anyone qualify for that. And currently our state allows for that. So currently anyone can go get those benefits. They don't have to prove any kind of, citizenship or anything like that.
Or permanent residency.
So as all we're saying is like, hey, let's just make sure we're using it for Idaho residents, because these are Idaho dollars that should be used for Idaho residents. And again, we have a finite number of resources, right? We need to make sure that we're protecting Idahoans with those resources and not just wasting those dollars or giving those dollars to folks that are not here legally.
I have a question for you.
Yeah.
Eagle passed an anti-sanctuary city ordinance in like May. And in my mind, it predominantly did that because of a video that went viral of, like these 3 busloads of illegal immigrants getting dropped off at the China Buffet at Fairview and 5 Mile. And what that actually was because I talked to Sheriff Clifford about it. He's like, no, we sent ICE. Like we got notified, like we sent ICE, and they were H-2A visa workers going to Oregon. They stopped at the China Buffet for dinner, and they had papers and everything was checked out, and people lost their minds over this. They're like, oh my God, it's crazy. Now that led a couple months later to a lot of anxiety in the community that we were like being inundated with people, draining resources. So Eagle passes this anti-sanctuary city ordinance, which was curious because nobody, like there was no articulation of any value spent on illegal immigrants, meaning like Eagle doesn't run hospitals. Eagle doesn't run schools. Eagle doesn't run emergency housing for illegal immigrants. Right. So there was this reaction to like, we really don't like this. Now, do we have any idea like how much money or funding in the state of Idaho right now is going to programs like this for illegal immigrants?
So it's difficult because we don't check for that, right? So it's difficult to track that, but I've heard several estimates that are in the multi-millions of dollars, but it's difficult because we don't ask for any of that information. So we don't actually have good data on that. And so all we're saying is just like, however much there is, we just want to make sure it's protecting the folks that are here legally, Idaho citizens using Idaho tax dollars.
And bottom line is, if you're just saying, hey, look, we don't ask for it, can we just all agree that that's not a good thing? Okay. And just ask, like have a mechanism to verify, residency status of some sort, either as like a green card or whatever, but like just ask.
Yeah.
And that's it. That's a reasonable thing to do. So you're not even saying, hey, look, we're wasting billions of dollars on this, but you're saying, look, the number's probably not zero.
Yeah.
We can't verify because we haven't asked. And if we ask, we'll find out one of two things, that it was either a very small number or a very big number, but either way, we'll find out what the actual number is, and we will stop that number from coming to pass again.
Yep, exactly right. And I think part of that thought too is let's not make Idaho necessarily a magnet for that, right? Because Washington, Oregon isn't going to do anything like that, right? So if folks are coming here illegally from the southern border or wherever they're coming from,
sure, wherever,
they got Oregon and Washington right now that are they're accepting of that, right? And so we're just saying, no, let's steward our dollars better. Let's balance our budget. Let's make sure that we have those programs, those safety net programs that are important and we need to keep focused on Idaho residents.
Man, what a difference right across. I was talking to somebody the other day who off air is like, listen, I used to be a big time libertarian. I used to be like legalize all drugs, like people will balance themselves out, all these things. And, he's like, now I'm like, I could not be farther from that. And he was talking about the beauty of being able to see what other states are doing.
Sure.
It's like Oregon is doing this, and this is the result. See, Washington is doing this. California is doing this. Like we get the benefit of seeing these things and observing, okay, this has produced a better environment in a better state, or it has not. And for this particular thing, it's like, yeah, look, you can do this over there and you will get this result. You will have taxpayers in Washington, Oregon, and California paying for these things. And if they like it, great. And if it works for them, great. But like, that's really not what we want. And we're not saying you can't do it. We're just saying that we're not really into that party.
That's exactly right. I think that's the whole point of like a state's rights, right? The states can kind of direct how they want their government to function. And this is what I believe is probably favorable in our state. And so that's why I'm running the bill.
God bless it. Representative Redman, I appreciate you.
I appreciate you, man.
Round two in the books. I really appreciate you articulating what you did about Medicaid reform.
Yeah.
Again, it is very complex that like, I don't even know what all the 11 waivers are. I keep getting this patchwork stuff. But I just really appreciate your perspective on it. 'Cause again, coming into this is like, wait a minute, if this is so bad, then like, why are we doing this? But again, no matter how flat the pancake is, there are two sides to it.
That's right. That's true.
I really appreciate you taking my questions on that and explaining these things. So thank you for coming, sir. Let's do it again.
Sounds good, bro. Appreciate you.